29th week of gestation. In our Gregorian calendar, which is the one on the agenda, you are in your 7th month. However, in the lunar calendar, which is different from ours, which is due to the phase of the moon, each month has 4 weeks. You are entering your 8th month, depends on who you want to scare, 7th, 8th. You choose what you mean, and that's why there's so much confusion around how many months you are. But the week is more important, and this week there is news about you, tips, including about hemorrhoids, this line that gets about 15% of pregnant women. Sorry, but I have a tip for you to get rid of all this. It has baby video, baby development, feeding tip that has everything to do with constipation. Does force disturb the baby? Does it cause for premature? It has that and more. So if you want to know, stay with me and I'll tell you. Hello, I'm Monica Romero. I'm very happy to have you here with me. 3rd trimester of pregnancy, starting with everything, and I want to start talking about you. Look at that beautiful belly. Her uterine height is around 29 centimeters. You can't hide a pregnancy. Not at all. My tummy is already moving. Have you ever felt your stomach move? Now, when the baby moves with his skeleton, it is stronger. We feel these movements more and can even move with our skin. So it is normal for this to happen. So tell me if it's already happening. And tell me if your partner, if your people who are close to you, when they put their hand on your belly, the baby stays quiet. The baby moves more. And the second question, when the daddy talks, the baby starts to move. My husband just started talking. My kids were already making a fuss, like I had arrived at Disney. I thought it was unfair because it had to be with me. But it's okay. These are things that happen to us. And because of the baby's hearing, it's getting better and better. And it's obvious that it reacts to various sounds. The first thing we're going to talk about here about you, about your body, is your breasts. Oh, areola, this part here is already darker, and she can zoom in to increase the contrast, right? Like your BBBO, your nipple may be more prominent. If by chance it's not your case and your nipple, it's inverted, like this one here. Oh, it seems like it's in there. You can see it. It seems like it's in there. Okay, relax. It's not for putting a silicone shell, nothing like that. We do nothing to prepare the breast for breastfeeding. Your breast is ready. What will happen is that we will have to help you in this case, mainly. But in both cases, it is important to hold the baby. Because what will make the milk come out is not the nipple, it is the stimulation of the baby in this region here, the areola. So he's going to have to make 11, grab deeper, snap. She is squeezing this region and releasing milk for him. For some women, the inverted nipple is actually a pseudo-inverted nipple. During breastfeeding, it protrudes and the baby will nurse normally. For other women who have this really inverted nipple, the grip a little more difficult, but I will help you, okay? You can rest assured that I am here for this and still have the flat nipple like this way that we will also have to adjust for a deeper grip so that the baby can grab as much of the areola as possible, okay? Remembering that when picking up the baby, you already get this tip, okay? First we'll pass, I'll take a little mouth here, just so you can have an idea. Look at my little mouth, what a beautiful thing. In this case, here's the break. Let me take off the break. It would be if when you have a tongue stuck, right? This interferes with breastfeeding, so we'll take it out here. Just to give you an idea, here is the baby's tongue when we stimulate baby like this, then with the mouth closed, right? When we stimulate. The baby opens his mouth as much as he can, and at that time we will do, oh yes, it's from here to here, and we can make a pincer movement to make it even more snapped. And here's what happens, breastfeeding. But calm down, I'll show you all this. There are videos about this already here on the channel with more videos coming out, all to help you in this process. In fact, be warned, stains may appear on the bra in your clothes due to the production of colostrum, but it's not to stimulate your nipples now, okay? Nipple stimulation can cause part of the premature baby, and we don't want that. Although the chance of your baby surviving without sequelae is already at 90%. Now, at 29 weeks, we may feel a little increase in cramps, and unfortunately, they may be more present. We may have an increase in trapped intestine. This building, right? In this part of the trapped intestine that I want to tell you about, around 15% of pregnant women have hemorrhoids due to pregnancy hormones, slow digestion, and also uterine growth, which leaves our intestine more pressured. It's normal, unfortunately, very normal. We have constipation during pregnancy. And the longer feces stay inside our body, the more they lose liquid, the more dry they become, and the more difficult it is for us to defecate. We suffer from it, yes. And when we have either very white skin or trends here, a lot of veins, right? Which would even be varicose veins, we are also more likely to have hemorrhoids. And what are we going to do with it? We have to change our diet a little, and this will be in my nutrition tip right now. But we also have to be aware that we not only have a routine that provides, we have a moment to go to the bathroom calmly, and also drinking plenty of liquid will help. The first warning that I want to give you, there are a lot of people who are afraid to push themselves when they are going to stop because of fear of abortion or interruption of the scholarship. None of that happens, okay? The force we exert to defecate is completely different from the force of childbirth, and it won't cause that, okay? You can rest assured there are other types of strength that we do, but the discomfort of being constipated, that abdominal pain, the bad mood that we get, that's why there is the phrase angry, because angry people have a lot of feces inside. This changes our mood markedly. Now imagine in pregnancy that we are already super sensitive, right? It's really hard to handle. I'm going to ask you not to take medications without your doctor's advice, okay? Many medications can be taken, but have appropriate doses for pregnancy. Talk to your doctor to avoid putting you and your baby at risk. And you can both use suppositories, including glycerin, serum. You can use them, but always talk to your doctor first. And I'll give you the food tips in a little while, but don't worry about making the strength to defecate, okay? This will not harm your baby. They are different forces, and he will not feel it. He's not going to get stressed or angry or have a premature birth because of it. But this enlargement of the uterus not only causes constipation, it also causes pressure on our blood vessels. They stay there more together, which makes it more difficult for the blood to pass. And now the tingling becomes more common. Sometimes the arm sleeps, the hand sleeps, the leg sleeps. We slept or stayed with our legs crossed for a little while. Just in time, everything sleeps again. To improve, the best thing you can do is stretch the limb that is tingling if you can move. Feed, beauty. Sometimes we can't. Oh, people, sleeping foot, sleeping hand gives a despair, right? Stretch this limb. You will already make your circulation flow better, okay? If you have, at the time you are sleeping, woke up a member there. Tingling tries to stretch, and if possible, stay on the left side leaning against the mattress. This side will leave a vein that is super important for our circulation called vena cava fria. It helps to circulate. What is the improvement in circulation? It also improves swelling, improves all the circulation in our body, the functioning of our organs. So it's very important. And besides, this position also helps reduce heartburn and reflux, especially when we are lying there, because our stomach doesn't stay straight, so it lies down a little. When we tilt a little, it stays down. It will keep all that liquid, right, digestive stuck and not inside our esophagus. Going through these tips, the last thing I need to ask you is, you're applying moisturizer, you're applying a little oil, especially on the belly, hips, here in the part, right? This back of the arm is also a stretch mark bomb there. Everyone forgets it's going well. Now, the hardest question, can you cut your toenail? What if you by chance shave yourself, right? With a blade, with wax, with something. You're doing it on your own. If you're succeeding, congratulations to you, because at this stage, hey, it's already difficult. It's not. By the way, if by chance a concern your depilation for childbirth, it is not necessary. It is not mandatory. You'll do it if you want, if you're comfortable with it. However, if a cesarean section is necessary and you have a lot of hair in the region, the nurse herself can make a scrape for you there with a razor only, where the incision will happen. Okay, so how much is this part of waxing calm? But if you like waxing, like me, for example, I prefer it, right? Being waxed, I'll give you a good week for you to do, or bracelet, but never for laser, okay? Laser during pregnancy can't be done, only later. Now it's not an option for you, but the razor or wax, that one, if you can continue using it, including in any period. But there is a period that we will talk about a little more forward for us to prepare for childbirth, okay? And let's get to my favorite part. Let's talk about your baby. Oh, what a delicious thing. It is important that the information I pass to you about weight, about your baby's measurements, are approximate measurements, approximate weights, because all this depends a lot on genetics, nutrition, where you reside. Yes, those who are in one hemisphere or the other also have differences in baby sizes. So stay calm about that. Your baby is older or younger. If the doctor says it's okay, it's okay. The percentile is a little higher, a little lower. It's also normal to happen. It's good. So don't be surprised by the measurements I'm going to give you. Your baby is measuring approximately 28 centimeters from head to butt. If we consider the legs, it can reach 38 centimeters and weigh around 1 kilo and 300 grams. He is a papaya. Daddy is from that big guy, that very big guy, the best, sweetest mother, the tastiest papaya. Daddy is from this world, and I already want to cover it with kiss. How I love a little baby, but oh, no kissing on the baby's mouth, huh? You can't even do it in your hand because he takes it too. We kiss the bald girl like this here, and only if it's with her mother's permission, if she's not sick, if she's not with a stuffy nose, if she's not with anything. If not, you can't. Anyone visiting a newborn must control themselves. I can control myself, although it's tough. We need to respect the baby's well-being. If we love a baby, we want the best for him and care for him properly. Another important information is that this measure that I pass from babies, they also serve multiple babies. If you're pregnant with 23 babies so far, they're growing the same way, at the same pace as single babies. The biggest difference is that the mother of the multiples, right? The triplets she has been suffering for longer with constipation, with back pain, with all her organs already pressing lungs, pressing bladder. So the mother is the one who is suffering. Of the most, but for babies for now, all part of development is the same. What will make the most difference in a little while is the size of the babies and the maturing part of the lung. The lungs of single babies are ready after the twins. Why? Because our body already knows that the probability of them being born earlier is greater. So the lungs of these babies mature earlier. And it is an adequate quantity and quality of surfactant liquid. I'm talking about him. It's already the 3rd week that I've talked about this liquid, okay? So I'm not going to explain much more about them. Right now, the central nervous system of the BBO completely formed, which will help a lot in controlling the body temperature after he is born. Although the fat makes a difference at the time of this control, then this little baby is very skinny. It is difficult for him to do this bodily control. He already has this ability that for now, our body is the one who regulates the temperature, right? We are always providing him with the same body temperature. Not a varied one, obviously, but always stable. When he is born, he will do it alone, and from now on, he is ready to take on this role. A curiosity is that babies, they already have preferred positions, so it is very common. Sometimes we are lying on one side or in another position, and he starts kicking anyway. Oh, change there. I didn't like that. They are bothered by various positions we are in. And he starts asking us to change and keeps kicking for it until he gets it. For you to see that little babies already have will, they already have personality. Another really cool thing is that your head is now much more proportional to your size, right? You're not so big-headed anymore. Your brain is also already able to control the baby's breathing, which means that if the baby were born now, premature, it would be an extreme premature A. His chances of surviving without sequelae are 90%, and going up, we usually say an average that every day inside the belly means 2 days in the ICU. Okay? So if your little baby is born now, he will need a longer ICU time than if he had stayed inside your belly. That's why so many doctors fight so hard to delay the internal birth, mother, exactly to increase that time he would have, right? Decrease ICU, that will do him good for sure. And your little baby has learned, you know what now, new ability to cough. And believe it or not, he'll use it against you soon enough to get attention. As soon as they have a little week, they start coughing just to get our attention, and they succeed. It's super effective, but they learned. Now, at 29 weeks pregnant, he has learned to cough. And this also means that he has perfected his movements for sucking breast milk. More news is that your baby's skin, as it is having a larger fat deposit underneath it, is getting less wrinkled. It is smoother. And if by chance your baby has already changed position from pelvic, which is when he is sitting, to cephalic, which is head down, he probably can't get back because of the weight of his head. Your brain is heavy, right? Because of the weight of the head, many babies cannot sit up again. But don't worry, they can still sit down. This movement can still happen. It's just getting harder. And an information for you are the positions that the baby can stay in the belly. And that can mean a difficulty for normal birth or even a cesarean section. It has 3 main positions, which would be cephalic, pelvic, or transverse. Unfortunately, the transverse position that he is on his side is indicative of cesarean section. The cephalic position, which is head down, is ideal for normal birth and sitting. Although many doctors say that you have to do a cesarean section, some doctors can do a pelvic birth, but it is still a little more complicated. Not all doctors are beasts in this matter, let's say so, but yes, it is also possible. If your baby is sitting up, do you really want to give birth normal? And you have the option of choosing your doctor, which is not the reality of the women who are in the SUS. You have that option. You can research doctors who are more specialized in difficult births, for example. All right? So this information is already there for you about the main positions that your baby may be in at the time of delivery. And if you're scared, don't know signs of labor, I'll leave him at home here for you some videos about it. But over the weeks, I'll give you more warning about it, okay? But mostly, is there pain? There is bleeding, abdominal stiffness. It is painful and it is increasing in intensity. That is the pain decreasing the intervals between one and another, and its duration is getting longer. When you look for a hospital with obstetric care, a maternity hospital, or contact your doctor Mucus Plug, many people have doubts. How is the Mucus Plug? How am I going to know if I missed it, and if it comes out in the pee, I didn't see it? He's not going to leave like this without you seeing it. Pretend there's a big uterus with a baby here. I don't have a uterus with a baby. This part here is our brain. Okay? During pregnancy, it is tightly closed, elongated, and in the middle of it, we have the mucus plug when we are preparing for work. During childbirth, the cervix begins to decrease in size. We call it erasure, as you can see in this image here on the side. It begins to decrease in size, and as soon as it is erased, that it is more flat, is that it begins to dilate during this process of erasing the cervix within it. There is the mucus plug, and we can lose this plug, which has a characteristic similar to phlegm. The amount is similar to a tablespoon, and it may have traces of blood, or is it not, footprints of blood, which can go to that brown, a coffee spatter or live blood. Okay, this is the mucus plug, that's where it stays, and we lose it when the cervix is decreasing. You lost the plug, you're in labor. Not always. Some women lose the tampon before, but this indicates that within 2 weeks, labor can begin. Some women just lose the tampon during labor, okay? So what you have to be aware of is, if you lose the mucus plug, it is important that you seek medical assistance. For what? If you haven't started labor, we can hold it so that it doesn't start and your baby stays longer in your belly. And my nutrition tip, as I said before, will be to help you get rid of constipation. What happens is that by increasing our fecal cake, we have more feces and a peristaltic movement that makes this bowel movement more efficient. As he is pressed, as he is with hormones making him slow down, has a larger fecal cake, helps him push more easily. What are we going to do to increase this fecal cake? Ingesting fiber, because the fibers we release in the stool, it increases this cake. So if you exchange everything that is normal white flour for whole wheat flour, it helps not only in the fecal cake, but also for health. It is better fiber. These fibers that are whole grain, like brown rice, whole grain bread at bread time, look for if it is enriched flour or if it is 100% whole grain. If you think those that are on the 100% whole label are better, okay? You can also improve the functioning of your intestine by eating prune. Prune, it is excellent. If you don't like plum, you can put a little bit of it in the water, let that water stay. darkened and taking sips, you don't need to take it all at once. A hand also helps you. And these foods that I'm passing on here to you, they all help in one way or another in the functioning of our intestine. Remembering that vegetables are very, very good, not only because they help the intestine function, but also because of the vitamins they bring. The more colorful your dish, the more different vitamins you're putting in it, the better for you. And everything that will feed you also feeds your baby and them. You feel the taste there in the amniotic fluid, so the diet varies a lot for him to try various things. And at the time of food introduction, who knows, he is remembering these foods. This will also facilitate the introduction of food. And in my tip of the week, then there are two. Again, I'm not saving on tip anymore, am I? There are two every week, but there is a tip in Monica. My first tip is this maternity bag. Did you know that there are 3 bags? 3 maternity suitcases, one for you, one for the baby, and one for your companion. That doesn't have to be your responsibility. I prepared for you a super quick guide on my Instagram, by the way. All the images you are seeing in this video are there on my Instagram. Follow their Parents' Almanac, but I prepared a quick maternity suitcase guide to help you. What do you need to take? What do you not need to take? What do we most forget? The necessary documents. I'll leave the link here in the description so you can download it. Already this guide, but there are also these images that will help you guide which bags we need to pack, okay? And don't forget the documents. We need to take the exam. We need to take the Group B streptococci. What is this, Monica? It's from the swab test that you will do there, close to 35 weeks. I will talk about it. You need to take the result. So there is a lot that we need, and you can also visit the maternity hospitals or hospitals where you intend to give birth, and there they will give you a form. So if you already know where you want to have your child, if you have already been there to visit several hospitals and maternity hospitals receive moms, it's time for you to make these visits. Go visit, take these tabs. You are not going to hand over these tokens now. They will stay with you inside the maternity suitcase, just so you don't forget. And my second tip, the fingers are already chubby. Is it not now? It's time to take off this ring, keep it in the jewelry holder, or put on a chain around the neck, or on a bracelet. Have a tight ring at that time of the championship. In addition to disturbing your circulation, you may have to take it out, even in a hospital. It can make you lose your ring, which sometimes have to cut to be able to take off the finger. So, time to avoid rings now, please, so as not to bring you this complication. And if you are very swollen, walking can help you at that time, okay? So why don't you invite dad-to-be or a friend for a walk? Slowly in the late afternoon or early morning at the weekend in the park to stimulate your circulation and help your health. If you don't have a company, calm down. I'll get you one and play a song for you to listen to. Walking with music is super delicious. Put the songs you like. If you want to sing too, sing, have fun. Enjoy this moment that you are dedicating to yourself. It is also important that we not only take care of our baby, we also have to take care of ourselves. I hope you enjoyed this video very much. If you liked it, don't forget to leave it. If I enjoy it, here is so important to me. I'll see you in the next video.